Hello everyone and welcome to Breckcast, Breckland Council's podcast, our new way of reaching our residents, our business community and our valued partners. Throughout our podcast series, we will be exploring the work of the Council, lifting the lid on how we deliver the services you rely upon, discussing that delivery with our partner organisations across the district and further afield, and exploring the issues that matter to you. I'm Stephen McCarthy from the Breckland Communications team. Today, we are celebrating Social Prescribing Day. First up, we will hear from Breckland's Executive Member for Health and Communities, Councillor Tristan Ashby, on the role of social prescribing as a cornerstone of Breckland's Inspiring Communities programme.
Hello everyone. I'm delighted to join you today as we mark Social Prescribing Day, an important moment to celebrate the power of social prescribing in transforming lives and strengthening our communities. As Breckland Council's Executive Member for Health and Communities, I am proud of the work our team of social prescribers are doing to support residents in living healthier, happier lives. Social prescribing plays a vital role in our approach to community well-being, offering people non-clinical support to improve their health and quality of life. Whether it's connecting individuals with local activities, social groups, or practical support services, social prescribing helps to address the wider factors that impact health, such as loneliness, mental well-being, and financial hardship. At Breckland Council, we are committed to tackling health inequalities, and social prescribing is a cornerstone of the pioneering Inspiring Communities programme. This initiative brings together partners and resources to provide tailored support for those who need it most. Through collaboration with local health services, charities, and community groups, we are ensuring that residents have access to the right help at the right time, empowering them to take control of their own well-being. But we know that local councils cannot do this work alone. Addressing health inequalities requires a whole system approach, with councils, the NHS, the voluntary sector, and local businesses working in partnership. That is why Breckland Council continues to advocate for greater collaboration and investment in preventative health measures that truly make a difference. Today, as we celebrate the impact of social prescribing, I encourage all of us to champion this work and explore new ways to support the health and well-being of our communities. By working together, we can build a healthier, more connected, and more resilient Breckland.
That was Councillor Tristan Ashby, our Executive Member for Health and Communities. Now we're going to get down to today's discussion. So today I'm joined by Nick, Barbara and Jan, and we're going to talk about social prescribing. To start off, what is social prescribing? What does a social prescriber do, Barbara?
Social prescribing, a lot of people, they go to the GP surgery, but there are issues that they're dealing with that are non-medical issues, and that's where social prescribing comes in. You know, we offer that support to people around those non-medical needs that might be adding stress to their well-being, and those issues might be housing, loneliness, benefits, isolation.
Social prescribers work with people in a way by having a conversation with them about some of those other issues that are impacting on their life, which can be around debt, housing, mental health, all the issues that can happen throughout life. And sometimes we find those more difficult to deal with, and they then have an impact on our physical health as well. So it's about having time and a conversation, and we provide that space for people to have a chat about where they are with things and what's happening, and kind of devise a plan or a way forward to look at either signposting some of those issues onto other services, or it might be encouraging them to go to a group, it might be, but it's very much based around their need. It's very much person-centred. There's no kind of you must do this or you must do that, or this is what you've got to do to fix it. It's about them thinking about their own solutions and us about supporting them with that plan, or sometimes there's signposting to other services, depending on kind of where they're at with things.
And that's why that conversation that we have with people is so important, because we always say it's like I'm peeling an onion. We start off with one thing, and the longer the conversation goes on, the more we find out about that person and what their needs are. And yeah, our role is about empowering them to move forward and to try and make their lives a little bit better.
And you both touched on the fact that the issues that you deal with through social prescribing actually have a physical and mental health impact as well. So the second thing that I wanted to ask about was, you've both mentioned there about the fact that social prescribing can have a real impact on physical and mental health in terms of traditional medicine. What is the kind of impact? I've heard a figure mentioned around social prescribing and early intervention through Breckland Council has saved the NHS locally around £6 million in recent years. Is that true? Is it something that you really see a massive impact on?
Yeah, I think it is really about that early intervention, as you say. I mean, what we do is we offer people time. GPs haven't got the time to address those issues, and we have. And the whole idea is to get in there early, help people at that very earliest stage so they don't reach crisis point. They don't have to go on. They don't have to, those issues don't get too bad that they might be hospitalized, or they, take up other services, which actually can be nipped in the bud if we speak to them early enough and give them, the help that they need at that early time, so that it doesn't, as I say, go into a crisis.
And it can help those repeat admissions to go into the GP, those repeat visits. Often people can go with those underlying health conditions because they're aggravated by their mental health, because they're worried about their debt. If their debt is reduced or their social isolation is improved, they're going to a group, they're getting more contact with other people. That then reduces that need on feeling that their health is so bad, so they don't have so many admissions to go to the GP, which obviously has a cost implication in the long run. But more effectively, it kind of improves that person's general health and well-being and overall health and well-being.
Jan, are there any real standout examples that you can recall and that you can share with us today where social prescribing has significantly impacted on someone's quality of life?
Obviously, we have referrals that come in from social prescribing, and they can be through health services, or people can self-refer. And sometimes people have quite high mental health issues. And I had a referral for somebody who had PTSD. Mental health services were involved, so we looked at other ways of support that might be available for that person. So after several conversations and allowing time, because social prescribing is about what matters to a person, so we looked at other things that we could help with. So finances, they were trying to apply for KIP, but because of mental health issues, that could be really overwhelming, putting in a PIP form. So we filled that in together. We looked at council tax. Turned out in the end he was paying too much, so actually got a rebate on his council tax, and also connected him to other sort of mental health services that may be able to help as well. So sometimes it's not just around sort of people's mental health, it's about those other things.
All those contributing factors. You mentioned something there that I thought was really interesting, which is that they take the lead in many ways in terms of the issues that they need help with, that it's their focus.
Yeah, because it's about, social prescribing is about what matters to that person. So it can be little things like Nick and Mo said, it could be debt. It could be that someone feels lonely and isolated. It could be that people are not, don't have enough income coming in. They could be struggling with filling a PIP form or attendance allowance. So there's quite a lot of different input that we can have, but we are led by what the person wants and what they think will make a difference.
I think it's really important, actually, what Jan just said about the way we work with people, and especially the way we work with people. Just because they have complex mental health issues doesn't mean that social prescribing can't help them, because if you look at the other issues, just like Jan said, their finances, benefits, maybe their loneliness, if you can alleviate some of those, then that will take away from that additional mental stress and help them in that way. So I think that was a really good example.
Can social prescribing have an impact across all age groups, or are there particular age groups that social prescribing is aimed towards?
Well, historically, social prescribing, for some reason, has always been 18 plus. So we've always sort of dealt with the older age group, but just recently, a younger age group has been emerging more. So from my point of view, as a young people and families social prescriber, this has been a really exciting year for me because I've been able to take on a project within the Mid-Norfolk PCN, which, as you know, are the surgeries that we work within. They're the Durham and surrounding surgeries. So we now have a youth offer, which is from 11 years up to 18 years, 25 years with SEN. And we have 4 parts of that offer. There's the social prescribing, which is that all-round holistic support for the young person. And we don't take young person just in isolation. We also work with the families as well, that anything might be impacting on them. We have an enhanced recovery worker, which is around moderate mental health issues. We have health and wellbeing coaches that look more around those, physical maybe aspects. And we have our MAP youth mentors. We work closely with MAP, which is a charity from Norwich, and they deliver youth mentoring within schools. So I work very closely with them, and that is somewhere where I can send my young people to look at those changes they want to make in their life. It's very youth-led, and they can look at what's happening in their life and look at various different options about the way to progress forward, set themselves little targets, and hopefully emerge at the other side, in a better place than when they went in. And I'm going back to our earlier conversation. That's all about that early intervention as well. We do have quite complex cases come in, but actually it's also about those young people that, maybe haven't got many friends, that you see standing in the playground on their own. Let's talk to them. Let's tell them what we can offer them. So it's been a really exciting time. And I think based on this first year, we're going to move forward into the next year and look forward and see what else we can do.
In terms of collaborating with local organisations and communities, how do you work with them to develop effective social prescribing options, Nick?
One of the things that we do is we have a big collaboration meeting that happens every Wednesday, which is with our partners. So from social services to local voluntary organisations, lots of different, I can't remember how many precisely there are. Do you know how many?
Oh my goodness. I said it was about 60 now.
Yeah, there is 4. And so we have a meeting, it's an online meeting where we can bring cases forward and we can collaborate together to find some solutions for those the difficult cases that happen. So that's a really good way to partner with all those organisations. There's 2 conferences a year as well that happen, so we can get together with people then. Yeah, so the collaboration is one really good way to partner with those organisations and let them know about social prescribing. We can have good input there. But there are other ways. We are trying to get out into the community and work with some of the organisations directly to develop those conversations. And we've got a really good project that's going to be happening called Chatty Chairs, which is for Social Prescribing Day. But I think we're going to talk a little more about that in the coming questions.
We talked about the fact that this is people-focused. At the centre of that, though, you need to build a relationship with those people. How do you build a relationship?
Bring different skills, because we all react with people in different ways, doesn't we? Yeah. But we all get the same end result for people. However we get there, we might have just the same person, and our approach with that person might be completely different, but they will end up in a better place for it.
And I think that's a really important point to make, because it is about that. It's about the relationship bit that we have, that we develop that relationship, that rapport with somebody. And often we have to do that fairly quickly, but also we can have a longer relationship with them. Our work isn't a one-off phone call. It can be over a period of a number of months. It can be a visit. So it's really about developing that trust, developing that relationship, which sometimes people haven't had opportunity to do with other services. I feel like we're in a really privileged position to be able to have those relationships, go to people's homes, go and visit them. There's lots of services that aren't able to do that anymore. And I think social prescribing is we're particularly lucky in the work that we do, that we're able to, I feel really privileged to have those relationships and have those conversations with the people that we work with. It's brilliant.
I think you're right in that we have to build up that relationship very quickly in almost that first few minutes to half an hour, those conversations that we have, especially with young people.
Yeah.
You know, when I speak to young people, I have to sort of gain their trust really early on, and they have to know that when I say I'm going to do something, I'm going to do it, even if it doesn't have the outcome that they might think. You know, I don't go back on my word for what I'm going to do.
Yeah, it's about that trust. It's building that trust. Yeah.
I had the pleasure of joining some of you out in the Queen Mother's Garden in Durham yesterday, just before the rain started, with the chatty chairs. How is it that people can get involved in Social Prescribing Day this year?
Well, Social Prescribing Day is the 19th of March, and we're going to run our events over 2 days on the 18th and the 19th, so we can really make a big impact locally in the community. And we have managed to recommission some chairs. They've come out of retirement. They're called Chatty Chairs, and they're beautifully decorated. They were devised for a Better Together project that ran in Norwich, and the lady who ran it, she retired, and the chairs retired with her. And they are beautifully decorated in a lovely poem called People Need People. And we have got a plan to go to various places in Durham. So we're going to go to one of the mental health groups. We're going to go to the Link. We're going to be here at the office. We're going to go to Durham Library, lots of different places. And we're going to set up with our chatty chairs, and we're going to have nice snacks and lots of information so that people can come and really just have a chat and learn about what social prescribing is, learn who we are. We'll have, as I say, some information, but it's a really informal and fun way just to get a bit of engagement. And it's kind of, what's this about? What are these chairs? And so we feel really privileged that we're able to have the opportunity to do that. And we think it's going to be a really, really nice, a fun and different thing for us to do too, and to be really in the community with everybody. And I'm really looking forward to it. I think it's going to be a great couple of days.
Jan, how can people avail of social prescribing? Are they referred by someone else? Can they self-refer? How does someone seek out your assistance?
So they can be referred by their GP or their GP surgery. People can self-refer through the Breckland website. Also, posters and leaflets, they've got QR code. Other professionals can refer as well.
When we first started, and we've been working in Breckland now for this is the 4th year. When we first started, it was GP referral only.
Yeah.
But because more and more people have got to know about us, more and more organisations are working with us, then anybody can go online and find our referral form and refer into us. Yeah, and that includes self-referrals as well.
And it stops that contact then with their GP. It stops that extra visit. It's not like somebody else has got to do it. They can put what they want on the form. But what I would say about the referrals is sometimes people do put one thing down, but often on investigation and on that conversation, it's like a little, like a acorn that goes into a tree. Like it can really, it can grow and grow around the piece of work that we do, and it can then lead on to other things. And sometimes people just think it's about one thing, but when you start having those conversations, it does grow into much, much more support.
That's why we think that the conversations are so important, because, like you say, sometimes when referral comes in and you sort of almost think about what you're going to say to that person, and then you might ring them or meet them, and it turns out that their worries and concerns are completely different than what's on.
Yeah, it can be something
completely different.
Yeah.
And actually what we haven't spoken about is we talk about conversation, but of course conversation is two-sided, and we have to be really good listeners and be very empathetic and, listen to those people to see exactly what they're saying, So listening is a really important skill in our role.
And there's two things that I think you've touched on, and I think we'd mentioned it earlier on in the conversation around the initial referrals coming from GPs in years past. That people will a lot of the time be put off going to a GP when they have potentially multiple issues that they might need to raise, particularly those GPs that put out that you need an appointment per issue. So the idea that they can self-refer, for example, through our website, and the link for our social prescribing form will be shared with this podcast as well, that people can self-refer knowing that that restriction, that potential blockage or barrier that they may feel or may perceive with a GP appointment isn't there with this. And then obviously if there is something that requires medical intervention or medical support, you guys will obviously advise them accordingly, but you'll be able to deal with all of those other peripheral issues.
And we do a lot of referrals back to the GP or other health professionals and other services if that happens, that it's other things that are needed that people feel that they need. But I think it's about them. Sometimes people don't always perhaps want to raise as well all those other things that are going on to their GP. Sometimes it can be really difficult to have, like you say, the time to even do that. So with the self-referral route, it's knowing that I like to think that our door is always just ajar. So we are here. People can re-refer back to the service if they need to. They can dip in for some support. They can have that support, and then life might go along and then something might happen. And then I say, well, you can re-refer back in. We're here. And sometimes just knowing that you've got other people, there's somebody there, there's somebody to listen. And quite often, one of the things that people will say regularly to us is, oh, thanks for your time. Thanks for listening to me. And sometimes the conversation just starts around, how are things with you? Just a simple thing. Tell me about how things are for you. It's not anything complicated. It's just an opener to have that chat. And sometimes just people giving the time to just say, well, this is what's happening with me.
We talk about how we can refer on and suggest other services and whatever, but sometimes all people need is that time to have a conversation with us. And then at the end of that conversation, they will say, that's all I needed.
Or we know when we talk to our friends or our family, when we do those things ourselves, when we share those issues or share those things, when we do talk to other people, it does generally, most of the time, make us feel better. It helps us to talk about it.
We've talked an awful lot about where social prescribing with Breckland has come from. We've talked about that you guys have been here for 4 years, and how the service has evolved, and that you're now working with 60 plus partner organisations in those collaboration meetings. Where do you see social prescribing going? What do you think is the future of social prescribing in Breckland?
Well, for me, in particular, with the children and young people social prescribing, I'd like to see what we've done in this past year, build upon it, get out there more. It's all about the first year was building up those relationships with our stakeholders, getting out into the schools, making contact with schools, making them aware of what we can offer. In the coming year, I think I'd like to be talking more to the young people themselves, hearing the young people's voices about what they would like to see. So I think that's, one of the main things I'd like to do. I've also got in mind another smaller project within a project, which is working with young carers, because they are disadvantaged at all ages, throughout their education. So the more help that we can give them, the better. And actually, I say that we deal with 11 years and upwards, but this year I'd like to go into more junior schools, the schools that feed into our main high schools in Dereham, and work with those younger students around transition, because that's a very worrying time for them. Lots of stress around that time. So see what we can do to help those young people and really just build the service and see what way it takes us.
I think that social prescribing is here to stay. I really hope, and I hope it's a growing and developing into different areas. There's a lot around nature prescriptions and green social prescribing, which is really interesting, about the influence of nature on people's mental health and well-being and how that can really help people. I'd really like to see more creative social prescribing, creative arts and health that can really improve people's physical and mental health and well-being, and kind of looking at more around that sort of thing, so we can perhaps specialise a little bit. The same with we've talked about young people's social prescribers, but perhaps in the future, and I know in other, because social prescribing is nationwide, and sometimes other places have particular specialism, so there might be a mental health social prescriber, there might be in particular areas. I'm really keen for us really to get more into our local community, to be perhaps having some pop-up social prescribing sessions at places like the Durham Aid Centre or different places that would be willing to have us for a little while, and really get out there to let people know what support is available so that they can get in touch with us and have that support and grow our referral rate. We're busy, but we're happy to be busier. We're always happy to have those referrals come through and kind of grow our service. But sort of the wider remit of all those other things as well would be lovely too for the future.
Well, that is an open pitch to the communities and groups of Breckland to get in contact and have a chat with our social prescribers on how you can get more involved in what they do. What is the message that you would like to get across to our residents about social prescribing?
We are just a small bit of Breckland, and there are other social prescribers that cover the other areas of Breckland, and that it is a county-wide service.
Okay.
And so I think that is quite important, because often we'll see people that will come into Durham, but their GP is they're in Attleborough or they're based somewhere different. But it's about knowing that they can get that support, and that there are social prescribing services, and they all operate slightly differently across the county of Norfolk. It is quite complex, but there are services for everybody across the county of Norfolk. So wider pitch than just Breckland, because we cover 7 GP surgeries. We cover a tiny bit. We're mid-Norfolk, whereas Breckland is a massive area, and there are social prescribers in other surgeries. In Swaffham, and there are. So we are just one little bit of it. So it's not only, my message would be that about social prescribing, but it's not just us, that it's across the county. So you understand what it is, so you can go and find out about it where you live. So you go, what is social prescribing? I know what social prescribing is. I'm going to Google that for my area, or I'm going to ask at my GP surgery, or I'm going to ask my neighbour, does she know where I can find out about that? Or I'm going to look at ways to find out about it and how it can help me.
Regardless of whether it's the local council that hosts the social prescribing, or whether, like you say, it's run by Family Action or whatever, they are always aligned to a GP surgery. So if you know about social prescribing, go along to your GP surgery. They will have a social prescriber within that surgery.
Does anybody have a particular example of an individual that has benefited from social prescribing and that it's had a really significant impact that they'd like to share?
Yeah, I had worked with a client for around about 8 months, and it started off with something. The referral was around the person applying for PIP. They'd got declined twice applying for PIP. I started off with a conversation. They were really nervous and anxious about sort of being involved with the service, but we sort of developed a rapport and realised that the client had really complex health conditions that had also affected their mental health and how they were managing at home. And we sort of, over a few phone calls, got sort of more detail, and they felt overwhelmed, their fatigue and their condition. They just couldn't keep up with managing the things in the house. So we made a referral to Breckland Safe at Home scheme that went in and helped do a one-off tidy and clean of the property to just make it more manageable and kind of just make it so that this person was able to manage and felt on top of things. He was over the moon and sort of really had contact with him. He's been able to sort of keep that up, which has been brilliant. We then built confidence, and he decided to make another application for PIP. So I did a lot of coaching around that rather than completing the form. It was very much a two-man job. We did it together and kind of built his confidence, because he'll need to reapply or may need to reapply. So it's about developing those skills. And it was really fantastic. He got PIP, which he was really, really said was life-changing for him. It really made a lot of difference to his circumstance. And then other things along the journey kind of happened, and he was struggling remembering to take his medications. So we had discussions around using technology. So I taught him how to set up his Alexa so that it would do reminders for his pills. So he took his medication on time, which is really crucial for people. And we also talked around kind of social activity and social isolation. He's really struggling to get out, but likes to uses computer, and so we were looking at kind of the services offered through the library, the audio books and the magazines and things that you can get, the digital services through the library completely free. So that was really good for him, especially being on low income. So he's able to have some of that as well.
Nick, didn't you get him the housing support fund?
I did. That was the other thing. I was just trying to think. Yeah, and also we worked together because he was having difficulties with cost of living to begin with as well, and got the household support fund of £300, which also made a real difference. So these things sort of gradually kind of came along through the journey of working together, and the outcome was really positive, and he's really feels that his life has improved a great deal from kind of those small things. It's more manageable. He's got more money to kind of manage his disabilities and conditions. It certainly doesn't solve anything or take those away by any means, but sometimes it's those. It doesn't have to be massive or huge life-changing things. It can be just really small things like taking your pills on time. It can be those really small things that can make a real difference. And sometimes it is just starting with those baby steps along a journey for somebody to make those changes, and we're supporting them to make those changes that has really good and positive outcomes.
Social Prescribing Day 2025, what is the national campaign all about?
Well, Social Prescribing Day, which is the 19th of March, as we've already heard, is a celebration, nationwide celebration of all things social prescribing. So it's just recognising what social prescribers can do in your community, getting out there, mixing with people, shouting it out on social media, making sure that everybody's aware what we can do, celebrating what we can do, and just generally joining in.
Well, everyone, you have been listening to Nick, Barbara and Jan, and before that we heard from Councillor Tristan Ashby, all celebrating our social prescribers and the wonderful work they do in and for our community. I've been your host, Stephen McCarthy from Breckland's communications team. Thank you so much for listening.